So let's start by talking about what is a clinical trial and what is clinical research. A lot of times when we think about research, the first thing that comes to our mind is a lab with test tubes, people in lab coats looking in microscopes. And that is where research starts. But then at some point where enough information has been learned about a potential treatment in the lab, then it needs to move into a clinical trial, which is where the research study now is going to involve people. So we're going to step out from the lab and go into the clinical arena. And it is through clinical trials that researchers find new ways to improve treatment and to improve the quality of life of people with diseases. This is how we get all of the medications that we use in diabetes, the new treatments, the new pills, the new insulin. This is how they come about. They first go through a rigorous research process, many clinical trials, and every trial that ever takes place that involves people has a person in charge, usually a medical doctor, who is called the principal investigator. And for example, Dr. Park, who's going to speak later, is a principal investigator on many studies, as is Dr. Verbalis. Next slide, please. So what is a protocol? When the principal investigator is preparing a plan for a study, they are going to write out a protocol. And the protocol is the detailed document that explains what will be done during the study. And it goes over all the details. What is the goal of the study? What is being tested? How is it going to be tested? What happens during the study visit? Who is eligible to enroll in the study? What are the safeguards in place to protect patients that are enrolled? And it's also going to have information that helps the study team decide if the trial is right for you, if you are somebody who's interested in participating in a research study. Next slide, please. So you may get a call one day from a research coordinator, or you may be visiting your doctor during one of your regular appointments, and they may bring up to you a study that you might be interested in. And they might say, given your lab work or your diagnosis or the medications you're on, I would like to tell you about this clinical study that is taking place that you might be interested in. And they will give you some basic information about the study. And this is where you, as the patient, we encourage you to advocate for yourself and ask a lot of questions. So you're going to start by saying, well, why is the study being done? How will this study benefit me? And what risks are involved? How long is the study? This is very important. Before you sign up, you want to know, is this 5 weeks, 5 months, 5 years? Some studies go on for a very long time, and you just need to decide if this is the right fit for you. You also want to know what's going to be asked of you, because when you enroll in a clinical trial, there will be study visits that you have to attend, and then you will be asked to do certain things, whether it is to take medications or to take your blood sugars or to weigh yourself or increase, change the way you eat, whatever it is you want to know. And then you also want to know if there will be any costs to you. Conversely, you may also ask, what is the study going to provide? Because, with diabetes studies, oftentimes the study provides blood glucose meters, supplies, study medication. So all of these are the kind of question that you want to bring up as you're trying to make a decision whether you want to enroll in a study. Next slide. So you also want to ask, what happens if I don't get the new medicine or treatment? So most of the clinical studies that we do involve, well, not all, but many of them involve a placebo arm, which means that you will be randomized, meaning kind of like the flip of a coin, and you might get the treatment and you might not get the treatment. So you want to know what happens if I don't get the treatment. You also want to know, am I going to be asked to try a new medication that hasn't been used before? So you want to know what do we know about this study, about this study medication? How many people have tried it before? What is known about it? And then if you decline to participate, you want to know, how will my care be different if I don't participate? And the answer to this is always that you will get standard of care. So if you decide not to participate in a study, you're not going to be deprived of access to what is available right now or the regular care that you get from your physician and standard of care treatment. But you just would not be able to access the study medication. The other thing that is very important to know is that even if you decide to enroll in a research study, it is entirely up to you. And then you can decide to leave at some point during the study. So you have full control in that situation. Next slide, please. So let's say you've been approached about participating in a research study and you've asked these questions. And then you say, yeah, I'm going to come in and I want to enroll. The first thing that's going to happen before anything takes place in a study is you're going to be presented with an informed consent document. And this document is basically exactly what it says. We need to make sure that you are fully informed about what you will be signing up for before you sign up for it. So it's a document that you're asked to review and sign before you can do anything in the research study. It is the first step. And this document will explain to you in detail why the study is being done, why you may be a good candidate for the study, and what you will be asked to do if you choose to participate in the study. So there's usually either a table or a list that says, you know, when you come in at visit 1, this is what's going to happen. And when you come in at visit 2, this is what we're going to ask. And maybe we're going to ask you to do this, that, and the other between visits. It will also list possible benefits and risks of taking part in this study. It will tell you who is in charge of the study. And a member of the study team, usually a research coordinator, will go over the consent with you and answer your questions. And that is what is called consenting. You will also be given the investigator's contact information, as well as contact information for the institutional review board that reviews and approves studies. So the Institutional Review Board is a board that is concerned with protecting study patients that are enrolled in clinical trials. They review protocols and they only approve them if they see that there is safety, safeguards in place to protect patients and that patients will be fully informed of what is going to happen in the study. Next slide, please. So another person that you can talk to try to decide if you want to enroll in a research study, or even if you are in the research study and you have concerns, then you can talk to somebody called a research participant advocate, or RPA. And this is someone who knows and understands clinical research, but is not part of any research study. So they're sort of like an independent counselor, if you will. And their job is to ensure that you are properly informed and protected as you participate in a research study. And remember that throughout this process, your participation is entirely voluntary and you may withdraw at any time. Next slide, please. So there are, in addition to working with an RPA, there's many federal, state, and institutional regulations and policies that are in place to protect participants in clinical research. Many. Anybody who is involved in research has to go through extensive training to make sure that they're doing things properly. And then there are a lot of rules in place that need to be followed. The RPAs enhance these protections by advocating for study participants, and they act as a resource both for the investigator and they provide independent oversight to the study. They can also serve as an objective witness during the consenting process. They can answer your questions, and they can discuss your concerns at any time during your participation in research. Next slide, please. So how to contact a research participant advocate, there's information on this slide, and I am sure that this information can also be accessed on the, by emailing GUTS. There's many ways that you can connect with support if you are interested in participating, but maybe you're a little bit concerned, you're wondering what it means, and you just want more information. And also, after you enroll in a study, there is support and help for you. Next slide, please. And so to drill down a little bit on a specific subject here, diabetes is, what a lot of us on this in this presentation do, a subject that is near and dear to us. And we all know, or most of us know that kidney disease is one of the potential complications from diabetes. And there are many clinical research tests that are trying to understand, diagnose, prevent, and treat potential complications from diabetes. And one of them is kidney disease in type 2 diabetes. These studies could not be done without the people who agree to take part. So the participants, whom we call study volunteers, help us researchers find answers to many health questions. And GUTS aims to educate the community on clinical research so that people can make informed decisions when trying to decide whether to participate in a clinical research trial. And guidance on what questions to ask before participating in a clinical trial can be helpful. And knowing your rights as a study participant or volunteer is also very important.